and welcome to Courageous Doctors, the new show for you and your doctor. On today's show, we're going to review Obamacare updates, look at other healthcare news, including health and safety tips. Now let's begin. NBC News. According to Consumer Reports, 75% of Americans cut back on food and other spending in order to afford their medications. That's no good. Star Ledger. The Health and Human Service reports that nearly 1 million have signed up for Obamacare, bringing the uninsured rate to below 10%. 29,000 of those new sign-ups are right here in New Jersey. In an article in the Journal of the American Medical Association, authors Allen and Adachi discuss private insurance purchasing co-ops. These are partially funded by the Center for Medicare Services. 460,000 people have signed up, half of them in these following states: New York, Iowa, Nebraska, and South Carolina. They offer competitive premiums and choosing your own doctor. USA Today, Obamacare caps individuals at $6,600 in spending and families at $13,200, and this does not include out-of-network expenses. That's much too expensive. But a ruling in February says that even out-of-network expenses will be covered, so possibly that'll help. New York Times, the insurance industry could now be dominated by a few very large potential mergers, including Anthem Cigna and Aetna Humana. Premium price hikes may occur. The New Orleans Times says that the Senate is now looking at a mental health parity law. Senators Murphy and Casita have been working on this for a while. If passed, there will be a number of updates in mental health services, including being able to discuss private matters with family members of people that are sick. And a new position is going to be created at the Department of Health as Assistant Secretary of Mental Health and Substance Abuse. Modern Healthcare says the Center for Medicare Services that state Medicaid directors can now use SNAP data, that's data collected at the Supplemental Nutrition and Assistance Program, in order to identify potential and eligible Medicaid recipients.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Berry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists, and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Hi, I'm Randy Lupo, host of The Randy Lupo Show on Broadband Box Office. Wait, is that a tongue twister or an alliteration? Come meet my favorite people, comedians, actors, writers, spiritual people, and everyone in between. I'm looking forward to seeing you.
Hi, my name is Marla Gruber, holistic health coach, smile expert, founder of the WIN program for children, a yogi trainee, and a mom to 2 teenage children. I'm excited to introduce into Dr. Barry's office my services of increasing your child's positive energy. My goal is to get the body comfortable so it can function at its full potential, enabling them to smile from the inside out daily. I will help both you and your child understand that being healthy is not just an absence of disease, it's having vitality. I believe that life is a journey, not a destination. I will help you enjoy the process of guiding your child to living a better quality of life and being the best that they can be. I look forward to helping you. Thank you for listening and keep smiling.
Let me move on now to other healthcare updates. The New York Department of Health is investigating a breakout of Legionnaires disease from contaminated cooling towers in the South Bronx. Hundreds are sick and some have died. The disease is caused by breathing in the germ through these vents and getting a life-threatening pneumonia. New York City has instituted strict laws on cooling tower inspections following this outbreak, and as I speak, even today, more and more cases throughout the South Bronx are being discovered. The Washington Post tells us that CDC, the Center for Disease Control, is now coordinating data with health facilities around the country to stop the spread of resistant bacteria. And Time reports that the National Antimicrobial Resistance Monitoring System is one of the tools the CDC is using to track the 2 million illnesses with resistant bacteria each year. Star Ledger reports that the infant mortality rate in New Jersey is now down 13%, looking at the years 2005 through 2013. Cases of sudden infant death, or SIDS, have dropped 26%. That's by babies not sleeping on their stomachs. The Associated Press looked at an article in the New England Journal of Medicine. It published a study that the FTO gene, a mutation in it, causes fat to be stored and not burned. So hopefully we don't have that gene. The New York Times reports on data from Europe, the United States, and Australia in a study showing that overworking long hours may lead to strokes. The Associated Press said that the FDA, Federal Drug Administration, has approved the first prescription drug made by 3D printing. It's a drug for seizures, and it's called Spritam. Associated Press says the American Academy of Pediatrics and the American Academy of Allergy are now recommending that infants at high risk for peanut allergies be given foods containing peanuts before the age of 1. Apparently, early exposure builds tolerance. Let's move on to health and safety tips. The Star Ledger says that the Center for Disease Control and the American Academy of Pediatrics are calling for later starting times to school, no earlier than 8:30. Currently, most schools in New Jersey now start at 8. The Academy also recommends that teens get 8 or 9.5 hours of sleep. Good luck on that. Now, critics of starting later cite 3 causes: trouble with bus scheduling, disrupting after-school sports programs, and not allowing older children to be home in time to take care of their younger sibs. Star Ledger warns that workout clothes, when you buy new workout clothes, they may contain toxic chemicals, so wash before you wear. The Associated Press says that OSHA, which is the government agency for preventing poisonings in workplaces, they have new safety rules in place for exposure to beryllium. That's a metal used in aerospace and electronics. They're now lowering the current level of exposure to 1/10 of its previous level. The Associated Press says that Hospira stopped making Symbig pumps in 2013. These are pumps used to infuse medicines in patients, and they're computerized because hackers changed the rates of infusion. Boy, we got to stop that. New York Times reports a study from the Journal of Clinical Oncology stating that high volumes of coffee, as much as 4 cups a day, actually decrease the risk of death from cancer relapses. When you have cancer and then you get a relapse, so if that's you, drink a lot of coffee. The Journal of American Medical Association had an editorial in April 2005 warning about data breaches in health records. And apparently 80% of these breaches are due to just neglecting fundamental processes, such as prohibiting storage of personal information on an employee's electronic device, using standard encrypting methods, and authenticating authorized users. Now, it's interesting that HIPAA, the privacy law, doesn't cover digital information on the internet like at some of the big internet companies, because the law was put into place before the internet. So that law needs to be updated. Star Ledger says that more adults die of bicycling than children. It's interesting. The Star Ledger says that New Jersey recently changed its car seats laws so that infants up to 2 years old and weighing less than 30 pounds have to remain rear-facing in their car seats, and up to 8 years old or 57 inches have to remain in a booster seat, and there should also be a 5-point harness. Lastly, the Star Ledger had an interesting article on watermelons by David Templeton, and he was quoting a study from Florida State University by Associate Professor Arturo Figueroa Galvez, and apparently watermelons have a lot of good benefits. They decrease plaques in our arteries, decrease our blood pressure, decrease inflammation in prostate and intestinal cancers, and the lycopene, which is the red part of the watermelon, has anti-inflammatory properties and also decreases stomach acid. The citrulline in watermelon produces nitric oxide, which is actually the chemical that dilates the vessels in the heart. Watermelon also has vitamin C, vitamin A, and potassium. Lastly, Mr. Templeton wanted you to know that watermelon is from the cucurbit family, and that includes other fruits such as pumpkins, squash, and cucumbers, he said, which are frequently mistaken as vegetables. Watermelon has only 80 calories per every 2 cups. Well, that concludes today's news show. Thank you for listening. As always, we welcome your comments, and we'll look forward to hearing you again next month.